Action. Hello, I'm Steven Mercado. I'm a student nurse at TANECC. My clinical instructor is Schubert, and this is my postpartum assessment. So first thing I would do when I knock, I'd walk in, I'd foam in, and I'd just introduce myself to the patient. I'm Steven Mercado. I'm a student nurse, and I'm just gonna do a postpartum assessment on you. Just check your general well-being and how you're holding up after the pregnancy. So, kind of just while you introduce yourself, make small talk. Like, how are you doing? Do you feel have any pain right now?
A little.
A little bit of pain. Where is that pain about? Right here. Okay, yeah. So that's probably it's on your incision site, probably. Yeah, so that's normal. We'll issue out your pain meds when it's time. Um, let's see. So yeah, first thing you want to do really is just take vitals. So you took pain, that was one of the vital signs. So we need to do blood pressure, heart rate, respiration rate, temperature. Make sure those are all within normal limits. Then I want to get out my stethoscope, auscultate her heart in all 5 areas, and all the valves. Then once I'm there, the lungs as well, each side. Boom, boom, and then you can also get the back. Now that you're there, might as well get the bowels, also take the bowels. It should be active at this point in time. Let's see. So, yeah, you handled all your stethoscope areas, auscultated everything. So you can look for CVA tenderness. Can I get you to stand up real quick? Turn around. And then tell me if you feel any pain.
No.
Okay.
No.
No pain?
No.
Alright. So no CVA tenderness, checks out. So next we're gonna go on to this acronym called BUBBLE, HE. And the first V starts with breasts, and that's kind of just getting an assessment, overall assessment on them, checking if they're soft or firm, if they're full, any pain, just kind of asking general questions and kind of assessing a visual assessment, any like open spots on the nipple, or if kind of just asking questions too about like if the baby's latching on, that sort of thing. But yeah, it should be soft by day 3. It should be soft until day 3. But yes, that's the B. The U, the uterus. Kind of just feel around for the uterus, palpate it. It should be at level with umbilical. If it's a little to the right, that would mean that the patient's bladder is full, so it's kind of pushing it to the right. And yeah, just massage that fundus, kind of get any blood clots out. That's you. The next B, next two B's are bowel and bladder, and you can also just assess these by asking questions. When was the last time you had a bowel movement or voided? But yeah, you also assess those while listening to the bowels for activity. And the bladder, you assess that by also checking where the uterus was, the position relating to the body. But yeah, you can also just check if she's been peeing by checking in the hat and measuring the amount of urine. The L will be lochia, and that's just, you assess that while massaging the uterus. You can also assess it by odor. If it has like a foul odor, that would probably indicate an infection. The E would be episiotomy, and that's referring to the incision site. That we can think of the acronym RITA, which is R would be redness. Try to look out for any excessive redness or inflammation. The E is for edema. Just make sure she has no edema surrounding the incision. The next E is ecchymosis, which is pretty much just bruises. The D is for drainage, and the A is for approximation. So you want a nice, good cut with good healing. Yeah, I'll just, yeah, we're good. Yeah, so you can just check all that, the incision. Then H is for Homan sign, and I know we don't really do that for HA, but we do it for OB. And that's, we can kind of just look at the calf and inspect it, look for any warmth, tenderness, or is that good? You feel good? Little massage. And then we can also check for reflexes. You get a hammer, and oh, that's the bad. She has a bad knee. All right, tap there. Put a reflex. So the clonus sign, that would kind of just be if you could scoot a little back. Let's see. So just checking for smooth dorsiflex when it places itself back in. Loosen that. And yeah, just make, when it goes back to normal resting position, smooth. Next up, we will do the, H-E. E will be for emotion, and that's just kind of, you can observe by asking, or even just visually observing, what's her attitude like, how is she taking it all, is she concerned about her baby at all, asking about where her baby is. That's a very normal response and what we're looking for. But yeah, here you can also just ask for, about postpartum depression. Ask her, is there ever any time where she feels like she regrets this, or if she feels like not taking care of this baby, that could be a warning sign for postpartum depression. We can look for any skin changes. She should have probably some stretch marks from gaining some weight during the pregnancy. There's this thing called mask of pregnancy. It's kind of like a discoloration, a little grayish of the face. Linea nigra, there's a line going down the belly button vertically, down the stomach. And then perspiration would be just kind of like excessive sweating. Usually night sweats is something that's not normal, most people shouldn't get night sweats, but if you're just had a baby, body will be trying to get rid of excess fluid any way it can, and so night sweats can be common after pregnancy. And then activity, make sure she's eating well, drinking well, plenty of fluids, 300 to 500 extra amount of calories per day. She could get back to her normal level of activity, except don't be straining and lifting anything heavier than her baby. And that should conclude the postpartum assessment. Thank you.